Welcome to Improve with Dr. Lindsay podcast. Here we blend the worlds of physical therapy and fitness and explore topics that help you to move better, feel better, and live better. I'm your host, Dr. Lindsay, a licensed physical therapist and an ACSM certified exercise physiologist. Hello, everybody, and welcome back. Today, we're talking about something that can feel completely backwards sometimes, and that is that movement is often the solution to pain, even when it feels or seems like the last thing that you should be doing. When something hurts, it's completely natural to want to stop moving. Your brain and your body's instinct is to protect you by telling you to rest and avoid using that painful area. But the truth is that movement can be the best medicine for pain. And today we're going to talk about why that is and how to start moving safely, even when your body or your brain might be telling you not to. This is something I personally experienced just earlier last week. I woke up with my back completely locked up, and this is something that happens to me from time to time and it has for many years. And usually it's after sleeping in a funky position or falling out of my usual exercise routine, and so when I've been more sedentary. But this time it was a combination of both. And on top of that, it was 5:30 in the morning, and I was supposed to be heading to the gym after taking about 10 days off from my usual routine. And let me tell you, my body had every excuse and every reason ready to stay in bed. I knew I wasn't injured, but my brain really wasn't getting that memo, and all the alarms were going off. It really felt like I shouldn't move, but my boyfriend and I had planned to do back day, and when I told him how I felt, his first instinct was, okay, we'll change the plan, we'll avoid using our backs for today. And then I told him, no, I actually think that I want to work it. It's probably going to help me feel better. And you know what? By the time we finished, I did feel so much better. And not only that, my back also barely bothered me the rest of the week. So this is a perfect example of what we're going to be talking about today. And while this is easier to understand when it's a chronic pain that you've dealt with for some time and that you kind of understand, this same concept can actually apply to many acute or new injuries as well. And research is showing the evidence and the impact of its importance across the board. So today, let's break down first why your brain tries to protect you from movement when you're hurting, and why gentle, smart movement is often exactly what you need to heal faster and feel better. But before we dive deeper, we first need to understand why pain makes us want to stop moving. Essentially, pain is a protective mechanism. It's our body's built-in alarm system. It's designed to detect danger and to help keep us safe. The simplest example of this is when you accidentally touch a hot stove. Your body immediately senses that painful stimulus and pulls your hand away without you even having to think about it. And the same goes for like stepping on something sharp, like a piece of glass. These are reflexive responses that bypass the brain to protect you as quickly as possible. And this is important because if your body waited for that pain signal to travel all the way up to your brain, you'd stay in contact with that harmful stimulus for longer, likely causing you more damage. Your brain can still react quickly, but these reflexes are designed to be instantaneous for maximum protection. Where things get more complicated is when pain does reach the brain and becomes subject to our interpretation. And this is why two people with the same exact injury can experience pain very, very differently. Our response to pain depends on so many different personal factors, but some of those include past experiences with pain or injury, coping mechanisms or belief about pain, emotional or mental state, and sensitivity of your nervous system, which most people refer to as their pain tolerance. Instinctively, when something hurts, our brain perceives danger and tells us to stop moving that area. And in the short term, this is a very efficient and protective mechanism and system that we have, and it helps to prevent further injury. But if we listen to the signal too much or for too long, it can actually start to rewire our nervous system, and that is when things can start to misfire, like a faulty or oversensitive alarm system, if you will. Our body can get stuck in a loop where it perceives movement as dangerous, even when there is no real tissue damage happening. And this leads to longer healing and recovery times, compensation patterns that can create new problems, the development of chronic pain, or even disability. When it comes to chronic pain, prolonged movement avoidance can actually become more disabling than the original injury itself. And this is something I see in my practice all the time. A great example of how this works is something I show my clients when I'm doing massage or manual therapy. When I'm working on a painful area, maybe their low back or their hip, I will actually apply the same exact pressure or technique to the opposite side so that they can kind of feel the difference and the side that doesn't hurt. And they're always surprised by how much less it bothers them, but also how little pressure I'm actually giving. And that is because the painful side has become hypersensitive, even though there may be nothing structurally wrong with it anymore. This is exactly what happens when the brain and nervous system stay on high alert long after the original injury is healed. And this is where things get tricky and why you can't always trust your brain's interpretation of pain. On the flip side of that, our bodies are actually very good at detecting real serious danger. Your body instantly knows what to do to protect you, and these reflexive responses are hardwired into us. So if something is truly dangerous, your body is going to communicate with you and tell you not to push through it. However, don't underestimate the power of your mind, because your brain is capable of overriding these reflexes as well. And that is where sensitivity can actually be dulled the other direction by pushing through pain chronically, which is why the proper focus, intention, and awareness on your movement matters just as much as the movement itself does. Where people typically get stuck is a fear of pain, especially after an injury. And this fear amplifies the brain's protective response, even if the movement is completely safe. That's why part of my job as a physical therapist is to help my clients become kind of like a detective of their own bodies. And we do this to understand what their pain is actually telling them and to build trust back and communication back with their body that can be used in movement. We spend a lot of time distinguishing what's normal discomfort that you can move through, something like a muscle soreness or a stretch, and what's a warning sign to back off, like a sharp stabbing pain, and what's a sign that something isn't working and needs to be modified. For example, let's say someone is working on hamstring flexibility, and so we are doing a hamstring stretch. It is normal to feel a stretch in the back of the thigh where the hamstring lives. But if they start feeling discomfort in the low back, this might mean that they're compensating or they're pushing too far. Pinching in the front of the hip could indicate a restriction in the hip joint itself. And this kind of detective work is what helps people understand the difference between a helpful discomfort or a productive discomfort and an unhelpful pain. And this is really the heart of what I do as a physical therapist. Our whole approach is built around identifying mobility, flexibility, strength, and coordination deficits, and then using specific targeted exercises or movement to help correct those deficits. When you restore normal movement patterns, you don't just relieve the pain that you're experiencing in the moment. You also address the root cause to hopefully prevent it from coming back. But even outside of physical therapy, movement itself has so many benefits for pain relief. It can help to manage stress, which lowers the nervous system's sensitivity to pain. It releases endorphins, which are your body's natural painkillers. It improves circulation, which helps to deliver the nutrients to your muscles and joints, which is necessary for actual healing to happen of those tissues, and is where the term motion is lotion comes from, which is a personal favorite of mine that some people hate, but that's okay. And so this is all pertaining to more like chronic things, but this same philosophy applies to acute injuries too. My best friend Kylee Warne is an athletic trainer and uses the same approach right after an injury happens as well. If you don't know already, athletic trainers are the ones who are working directly with the athletes on the field and in the training room. Instead of immediate rest or ice or immobilization, she actually encourages gentle active range of motion exercises right away. She'll have her athletes move through their pain-free range of motion and stop right before they hit pain, something that I also use with my PT clients all the time. But in her experience, 9 out of 10 athletes who start with an early movement approach versus ice, rest, or immobilization report less pain and faster return to sport. She also shared with me another thing that I completely agree with, and that is that there is always a modification. Pain doesn't mean that you have to stop the movement altogether. It just means that you might need to adjust. And that's really what I think the core mindset shift is that so many people need when it comes to recovering from pain or injury. And I want to be really clear. Not every injury is appropriate for early movement, and that is okay. Some injuries need more protection up front, and sometimes even short-term rest or immobilization to allow the body to heal. And that is why getting assessed by a healthcare provider is so important if you've had a major injury, or if you're just not sure what's safe to do. Some clues that you need to pause and seek guidance first includes hearing or feeling a loud pop at the time of injury, feeling like the joint is unstable or giving out when you try to put weight on it, being unable to put weight on the area without sharp pain, significant swelling, redness, bruising, or warmth around the area, or having very limited movement if the joint suddenly just won't move like it usually does. Also things like numbness, tingling, or any other changes in sensation. And of course, if you've had surgery, it's always a good idea to just check with your surgeon or healthcare provider first before you start any kind of movement. But on the flip side, there are a lot of situations where gentle movement can actually be the best thing you can do for your body. Movement can be incredibly helpful when you're dealing with things like waking up and feeling stiff and sore, chronic aches and pains that you've been dealing with for a while, a minor injury or tweak that doesn't have major swelling or sharp pain when you put weight on it, muscle tension from stress or overuse, or generalized joint stiffness from inactivity or posture habit. In these and many other cases, gentle movement like walking, cycling, active range of motion, stretching, or light strength work can often help you feel better faster. The key is keeping all movement within a pain-free range, or stopping just before you hit the pain. A simple way to think of it is move the painful area in all directions that feels good and modify if anything feels sharp, pinchy, or wrong. And it's also important to remember if you're still dealing with pain after, a week or two, you've got a recurring issue that just won't go away and keeps coming back, that is your sign to get checked out by a PT. Physical therapy doesn't just help to get rid of the pain in the moment. We also work to figure out what caused the issue to begin with, what compensations might have developed since the injury so that you don't trade one problem for another, what underlying limitations like mobility, strength, or movement patterns that could be setting you up for repeat injuries in the future. And the sooner we get to the root problem, the faster that we can help you feel better and stay better, so you can keep doing what you love without fear of the pain coming back. So if you take one thing from today's episode, let it be this: movement is not the enemy. For most aches and pains and even many injuries, gentle movement is part of the solution, not something to avoid. Your brain's first instinct is to protect you, but with the right knowledge and guidance, you can rebuild trust in your body and learn to move with confidence again. So whether you're dealing with chronic pain, recovering from an injury, or just want to move or feel better, or you just aren't sure where to start, that is exactly what I'm here for. And if this episode spoke to you in any way, make sure that you subscribe and share this episode with someone who needs to hear it. As always with Improve with Dr. Lindsay, we hope to provoke thought, expand understanding and awareness, inspire, motivate, and most of all, improve your life. Thank you for tuning in, and see you guys again next week.